complex when it comes to ENT things. They over time have been sort of made artificially complex, but you don't want them to continue to be more and more confusing or complex where you can't quite figure out things. The last time we were talking about the nose, and I'm going to just again review the things that the nose is supposed to do. I think that is absolutely critical. What are the functions of the nose? And you probably recall what we said last time, and always remember that, because it's a part of our critical anatomy that's very automatic. It's autonomic. To a great extent, it's totally autonomic, the internal parts of the nose, and it does things without us interfering in terms of any interference. It has to be a passageway for air. That analogy of putting a clothespin on your nose, well, in about 2 minutes you'll be very uncomfortable. It has to be a passageway for air, and the other one, you have to be able to smell what's in the air, because that's a life issue as far as injury or death or some horrible accident. You've got to be able to smell things. And then the internal part of the nose, as we talked about, you've got to be able to do a little bit in terms of warming up the air, and got to be able to warm it up a little bit and humidify it a little bit. Have to be able to do those things. It's got to be a passageway for air. Warm the air up a little bit. Passageway for air. Smell it, warm it, humidify it, clean it, and slow it down. That's 6 functions that the nose has to do, and it does it autonomically. Well, as we talked the last time, it does that rather efficiently because it cycles. The nasal cycle is very critical. It takes place 24 hours a day. In some people, longer intervals of cycle than others. Usually the average is about 3.5 to 4.5 hours a nasal cycle from one side to the other. And it does so, as we talked last week about these rather critical structures called turbinates. Here's just an illustration of this side is drawing air because the turbinates are constricted, or they're not as enlarged. Over here they're engorged and they're blocking air and they're resting. They're literally resting by shielding out the air. It says, don't come in now, I'm resting. Give me a chance to kind of recuperate. This side was once like this. It's now open so air can go through there, and once again, some air goes through here. As we said, it's about 85%, 15%. As air travels through there, you got to smell it, be a passageway of air, smell it, warm it up, humidify it, clean it, and slow it down. The air shouldn't travel through the nose with great speed, because if it travels through like an arrow out of a bow, it can't do those functions. Once again, warming, cleaning, smelling, humidifying, and moisturizing the air. So this nasal cycle is real critical. You never want to get away from that when you're trying to evaluate someone with a nasal complaint. Is the nose functioning for this particular patient? And I can find that out by asking just a few questions, or they'll tell you things indirectly to tell you that the nose is functioning. We also spoke about the amount of secretion in the nose, about a pint a day. It's a lot of secretion. And it's produced by these goblet and serous glands within the turbinate. Not very much secretion on the septum. The sinuses produce secretion that flow out through little ostia. The ethmoid sinus is here, the frontal sinus here, the sphenoid. They also produce material that comes out through the little openings. And there's a certain amount of protective activity in the lining of the nose. It's ciliated, so everything should flow to the back. The nose was not meant to drip anything out the front when it's normally functioning. Everything flows to the back, about a pint a day. Comes to the back, and then through the process of swallowing, with a little negative pressure, we draw it back into the oropharynx and into the hypopharynx, and we swallow it. We don't even know about it. And it happens even while we're sleeping. And we also spoke about how the nasal cycle tricks you to sleep on one side, and then in the middle of the night you'll turn over on the other side. And that's to protect our lungs from being compressed and not aerating on one particular side. So that's what the nose does. So it's not you're not supposed to be troubled with your nose, like running around with a pocket full of Kleenex all the time, dripping your nose. That's not one of the things the nose should do. Well, that'd be something that would say the nose isn't functioning well. But we also spoke about the dependent nasal congestion. These turbinates work by means of venous sinusoids. So when this side is done working, magically these valves allow blood to rush in through these turbinates and engorge them. The sinusoids over here open up and the blood comes out. Fascinating, absolutely fascinating how they work, again, autonomically, and how the nose is able to cycle. But some people that are totally dependent, there's a certain amount of hydrostatic pressure on those valves, and they don't like to sleep flat. There is a condition called dependent nasal congestion. They're flat, and the nose doesn't cycle well because when they're flat, the valves can't kick out blood when they should. But if they sleep with their head elevated a little bit, they feel much better. A lot of people just have a complaint of dependent nasal congestion. They like to have their head propped up fine. Others can sleep flat on a mattress. It doesn't bother them a bit. So that's wonderful and for them, but some people, they like to be propped up a little bit. One of the things we spoke about last week, one of the entities we spoke about is this condition called vasomotor rhinitis. And these individuals are usually, here I'm repeating myself, but I believe in repetition, so you'll remember. These people are usually elderly, well beyond the age of 60. They have lots of clear nasal discharge. They're always soaking up stuff in their nose. But what do we find out? They don't have trouble breathing. So you say to yourself, clear nasal drainage, but they can breathe comfortably. Is there something radically wrong with the nose? Mm-mm. Can you smell things? Yes. But boy, my nose drips, and it drips a lot if I'm eating. Very common condition of older people. Their nose drips, and invariably they're given decongestants and antihistamines, which is not wise. Not a wise thing to do because they may have cardiovascular disturbances, and that's not a very compatible medication for people who are elderly. The fascinating thing about it that no one's ever been able to explain, they have lots of clear drainage. It's not crusty burgers of any sort. It's just real clear. They have a Kleenex to just soak up things. But once again, to be repetitious, they can breathe perfectly fine. When they go to bed at night, magically it stops. People with vasomotor rhinitis go to bed at night, put their head in the pillow, say their prayers, go to sleep, and the nose never runs out while they're sleeping onto their lip and chin. Never does. But first thing in the morning, as soon as they get up, stir around, particularly if they stir around the kitchen and make coffee or something. And sometimes the aroma of food will accentuate this, or if there's a weather change. As soon as they get up on their feet, they go to the kitchen, their nose drips all the time. Yet they can drink coffee and have a donut, eat scrambled eggs, their nose drips. And as we said last week, sometimes it's very annoying, these people, because they're always told by the neighbors they have a cold. They don't have a cold. They very seldom sneeze, or they can, but they don't. And I don't believe in treating these with decongestants, again, as I mentioned, because they're sometimes a cardiovascular status. But there is a medication that can help. Most people feel that this free secretion from the nose is a disturbance in the balance between the sympathetic and parasympathetic nervous systems. They think the parasympathetic system is dominant. So why don't you try to shut that down? Well, you can with the nasal spray called Atrovent, and it works. There's 2 concentrations. They have to spray it and wait a little bit before it takes over, and it'll stop some of the secretion. As I mentioned last week, I'll use that now and again if they're going out socially and they don't like their nose to be dripping while they're having a nice meal somewhere. I'll have them spray the nose for an hour or 2 before going to bed, going out to have something to eat. But I emphasize the fact that, remember now, when you go to sleep at night, it doesn't drain anymore. And they'll say, you know, that's true. I lay down and it stops. In the morning it drains again. So that's called vasomotor. But these people are often treated with decongestants or medications such as the decongestants. The most common one in America today is Afrin. Afrin will stop it, but as we talked last week, what does Afrin do? Well, it'll decongest the nose until both sides look like this, and you throw the nose out of cycle. That's why I don't believe in nasal sprays, any decongestant nasal sprays. I've never suggested they be used because, you can breathe remarkably well on both sides. I never was able to breathe so well. That's not normal for you. And then, of course, since you disrupt the nasal cycle, you become dependent on the spray because of the rebound effect of the chemical, and you end up with a common condition called rhinitis medicamentosa. It's very common. A lot of people, I mentioned this last week, I bet there's 300 or 400 people in Omaha today that have rhinitis medicamentosa. They stop at Walgreens and buy any type of decongestant spray, and they have it with them. They'll never go on vacation unless they have it. They won't go anywhere because they don't want to have a blocked nose, and it'll block up if they stop spraying. So they spray again and go about their business, and that's called rhinitis medicamentosa. And these people have to stop the spray because it has a systemic effect in terms of their pulse and blood pressure. But getting back to vasomotor rhinitis, using a little Atrovent spray doesn't act as a decongestant, so they can use it and they don't become dependent on it. Or they maybe become dependent on it in the sense they like to have their nose not drain a great deal. But I'll tell them, use it when you're going to church if you're going out, but otherwise let your nose drip a little bit. And but remember, at night when you go to bed, it'll stop, and it always does. It will not drain at night when they're sleeping. It won't. That's the key. You find out from the history they don't have any trouble breathing. They smell and they breathe. They have a lot of clear drainage, but it doesn't bother them at night. What entity is that? It's vasomotor rhinitis. Seen in the elderly. Don't see young people with vasomotor rhinitis. The elderly will have that entity, and it's more and more common as demographically you're seeing more and more older people. And now, they don't all have it, but I'd say 50% of people beyond the age of 70, 75 will have some element. And it gets worse as they get older. They get to be 85. It'll be a bit more troublesome to them. But again, tend to be repetitious. It doesn't bother them while they're sleeping. They're perfectly fine when they're sleeping. We spoke just very briefly about allergic rhinitis. The tip-off there is that an antigen is disturbing the nose. They get a antigen antibody effect, and the nose swells up. So people with allergic rhinitis can't breathe. They went to someone's house and they're sensitive to cat litter. They just don't breathe. So the tip-off is they're not breathing. The other thing is they'll have some discharge, and they'll usually have an itchy effect in the nose, around the eyes, in the mouth. It's very straightforward. ENT things are not complex. And they'll do some sneezing, and it's usually, they're usually bright enough to figure out what caused them to have this intense disturbance of, I can't breathe now, and I'm itchy and sneezing. Well, you know, it's very, very easy to come up with a diagnosis of allergic rhinitis, particularly if it's seasonal, like in August and September in Nebraska. Those people respond to antihistamines, of which there's a whole plethora of over-the-counter antihistamines, not antihistamines and decongestants. I just don't like to use a combination. Antihistamines, and that's when steroid nasal sprays will work for allergic rhinitis. It is effective if used carefully, judiciously. But once they're away from whatever the antigen causes, then stop using steroid sprays. Just use it while you need to, but then otherwise, I don't like things placed in the nose. It isn't healthy, as you've heard many times. People who constantly use nasal sprays end up with some nasal atrophy of the mucosa, and they can end up with bloody secretion or nosebleeds. It's rather common. Long, prolonged use of Flonase, which is available without prescription, so there's probably a lot of people using Flonase when they shouldn't be using it. they don't do irreversible damage, but they can certainly thin the mucosa in the nose, and it's not healthy for the nose, because once again, the nose has to cycle. Always go back to that principle of the cycle. It has to take place. Well, obviously, with allergic rhinitis, the nose isn't cycling. It's all that intense reaction that's taking place in there. They're just not at all, and it's pretty straightforward in terms of what's happening to the individuals. Those are, and then we talked a little bit about reactive rhinitis. People react to just debris that's in the air. Someone who is doing a lot of painting, and they end up with a nose that feels a little bit uncomfortable, might burn a little bit, they might blow some dry secretion. They've been painting all weekend. They're reacting to that chemical that's in the air. How do you treat that? Well, obviously avoid the so-called irritant, using a mask, using saline spray. But again, I wouldn't suggest decongestants by mouth. I'm just not for that. The frequent use of sprays, when people are spraying a lot and doing anything, I'm a great believer in any type of protective mask. It is a benefit to them. There's just no doubt about that. I think we still have some time. Let's assume we have a patient. We have this gentleman, maybe he's about 52 years of age, and he comes in and his chief complaint is, I've got sinus drainage. You've got to help me with it. I've got sinus drainage. They're giving you a diagnosis because they use the word sinus. And that's something you got to be real careful of, because then you don't want to repeat that word sinus in your discussion with the patient. Don't ever repeat that, because that means that you agree with their statement. I've got a lot of sinus drainage. You just have to help me. And it's all about 52 years old, might be a truck driver. He might be on maybe a channel blocker for his blood pressure. He might be on a statin, and he's 6 foot tall, he weighs 225. I got this drainage. I just do. It bothers the devil out of me. How long have you had it? For years. What do you notice? Well, I get drainage. I got to hawk it out of my throat. I got bad sinus drainage. You got to help me. And what would you question the patient about? Do you have trouble breathing? I can breathe. Once in a while, one side gets congested. That's the nasal cycle. Sometimes I'll blow some debris out of my nose. But as a rule, can you get by without using Kleenex? Yeah, I can, but I feel that drainage. What do you do with it? I sometimes snort it out of my nose like, that's another great thing that people do. And then I spit it out. Can you breathe fairly well? Yeah. Your nose ever been injured? No. But I got that sinus drainage. Does it bother you at night? No. So you got sinus drainage, quote unquote, but you don't repeat the word. They have no trouble breathing. They don't have any trouble at night. Well, I get it in the morning a lot. I can feel it back in there. Well, I got to hawk that out there. It's coming out of my sinus. I know it. You drive truck? Yep. Anything? Any injuries? Any surgery? No. Do you smoke? I'll smoke cigars on the weekend. I play cards. I'll have a few beers, but otherwise I'm okay. Does he have a nasal problem? He doesn't. He's not having any restriction in his sense of breathing. And he says, you smell? I smell good. I drive truck. Sometimes I unload in warehouses. Boy, it stinks in there. He can smell. He can smell rather well, and he can breathe rather well. He's not troubled at night. At all. He's got sinus drainage. He wants some help. I'm fed up with this. I need drain. I have sinus drainage. You got to help. What will you do? Well, you don't have anything historically that can indicate that he has a nasal problem, because if you said he did, people would question you. Explain to me what function of the nose he's impaired with. he can smell and he can breathe. He's not blowing crusty old burkers out of his nose, so the mucosal pattern is probably very good. Is he aware of just natural secretion in the back of his nose? Well, if he is, then it should flow to the back and he should swallow periodically and not notice it. Well, isn't that what happens at night? Well, yes. At night, something's happening because he's sleeping rather well. So what are you doing? These are just rhetorical questions. So when you look in the nose, you don't see anything. You don't see anything in his nose at all. And he's not telling you anything bad about the nose. And so you feel this strange, and what do? Well, I just work at it. I kind of get it out of there. I spit it out. You do a lot of that? Well, at times I do. But you sleep like a baby. I'm tired. I drive truck from North Platte here. I sleep quietly. So in a simple office, you might be able to look in his nose and in the oral cavity and the oral pharynx, but you can't see much more. But even though you can't see much more, you'd say, well, could there be something in through here? He's talking about drainage, but it's not coming out of his nose. And he sleeps like a baby, more or less, but he feels this secretion. Well, very simplistically, when you're thinking of the hypopharynx or larynx, because you can see the oral cavity and the oral pharynx, you think, what are the functions of the hypopharynx? You've got to be able to breathe without restriction, swallow without restriction, and have a voice that's fairly acceptable. So he's able to breathe, he's able to swallow. He's not telling you that he has trouble swallowing anything, and he's not hoarse. So the likelihood of missing something in his laryngopharynx or hypopharynx, such as some outrageous infection, which is obviously not the case because it doesn't last for months like this gentleman has. He doesn't have any pain. He's not hoarse. The likelihood of an obvious cancer is pretty remote. But he has this material that he's always working at. Well, I'm prolonging this a little bit. He has no problem with his nose. That's been demonstrated. You can't make a case for a nasal problem because you'd be criticized. The likely effect that this man has would be reflux to the level of his oropharynx or even nasopharynx. You put that high on your list. Could be reflux. He's feeling it in his throat, and he's doing all these various maneuvers. Now, unless you really look at the area visually, you couldn't tell that. But you'd be better off making a statement that it's reflux than a nasal problem. You follow? It's most likely something not related to the nose of any significance at all, because he breathes fine, he smells fine, and he's not necessarily reaching and blowing trash out of his nose all the time. Sometimes he might be doing that. So I would put the possibility of reflux high on the list. Now, if you want to be real thorough, someone should probably look at his laryngopharynx just to be sure. But I don't think anyone would criticize you if you questioned him with regard to the possibility of having reflux. He told you he smokes cigars and drinks a fair amount of beer on weekends. Would that be a factor? Good. He told you those things. He's a truck driver, so they eat on the run. They eat junk on the road unless he takes stuff with him. So that would be a possibility. The bottom line in my discussion is don't treat the nose, because you can't justify a treatment for the nose. Now, if he says he's dry in my truck and I have these dry burgers, well, give him a nasal spray to over the counter, any spray to use for this dry mucosa in his nose. Because if it's in the wintertime, he's going to dry out his cab driving from here to North Platte and back.
Nasal saline, okay.
Nasal saline, I would do that. But that is not an uncommon complaint from patients, correct? Mm-hmm. I have sinus drainage. And you'd say, well, I think the best explanation to them is that you've got material in your throat that you suspect might be abnormal, but it can't be totally abnormal because you sleep rather comfortably. Because if it was significant, you wouldn't sleep at night, but you can sleep. So it can't be something that torments your sleep pattern. You're not hoarse, which is a good sign, not foolproof. But I think you'd be justified in talking to him about the possibility of reflux, particularly if there's other features in your history that he drives truck and eats late and eats a lot of spicy Hispanic junk food on the road. That would be a possibility. So would you be criticized in treating him as that, with a change in when he eats and what he eats and some simple proton pump inhibitors? Probably not. And then beyond that point to be reevaluated. The point of all this is don't treat the nose. Now he expects something for his nose, but you're not going to give him anything for his nose. Okay. But it's a very common condition in terms of what they relate to you. But see, if you have the simplest knowledge of the nose, you can sort of sort this out in terms of, is this truly a nasal problem? It doesn't seem to be. He breathes well. He mentions this congestion. It might be just a nasal cycle that he's aware of. His nose can't be a wind tunnel. No one's nose can be a wind tunnel and be normal. It cycles, and so they may pick that up. Sometimes they don't breathe so well on one side compared to the other. Well, explain to them, well, that's the way the nose, I didn't realize the nose worked that way. Yeah, I'd explain to people. I think patients should have a very simple explanation of the nasal cycle. They don't realize that the nose does that. A lot of them are surprised and thank you for that. Say, oh, I didn't know that. And I always tell them in the morning when you get up, if you're explaining this to someone, in the morning the cycle may not be perfect. Some people get up, the cycle isn't really fine-tuned, so they got to do something in the bathroom, take a shower, do anything, and then have something warm to drink, do anything, and then the nose gets back into cycle within usually 45 minutes to an hour. So morning congestion doesn't concern me, particularly if they've slept like a baby and they get up and they're a little bit congested in the morning. Just don't do a thing. Let them do their routine thing in the morning, have something to eat, maybe blow their nose a little bit if they feel like there's an excessive amount of secretion, which there can be in the morning when the nose starts to cycle. Not unusual to blow extra secretion. Then it'll settle down and get into cycle within an hour or less. Just leave it alone.
Can you get with allergies? Can you get like a like that gunk in the back of the throat? Can that just be like from allergic kind of like just, production of
no, I would say no.
Okay.
True allergic rhinitis affects the passageway of air. They can't breathe. I'm really restricted in breathing. Where were you? Oh, I was over at so-and-so's house. I got a new dog. No. This is something that's going to probably shock all of you. Don't use the word postnasal drainage. Don't use it. Why? Because the nose, if you collected every drop of secretion that came from someone's nose, you get a pint. Is that abnormal? No, it's not. I wouldn't use it. That's not a diagnosis. Postnasal discharge is not a diagnosis. It might be a sensation that they feel. Like this fellow is telling you that he's got this drainage. Is it coming from his nose? If it was significant and coming from his nose, it'd come out of his nose. It's not.
What if someone has a lot of sinus pain or pressure with all that?
That's a big topic for another.
That's our
That's very real.
That's our transition to next
very
week.
real. We can talk about that next week.
Okay.
When they come and they say
That's
they
personal interest.
Diagnose me.
because they'll come to you and they'll say, oh, I have a lot of sinus pressure. You've got to help me with it. Sinus pressure. Does the sinus have pressure without nasal obstruction? Yeah, we should talk about that because that's a very common one.
Yeah, you
So
can.
we can just look for the class.
But in terms of any allergic manifestation in the nose, to be significant, it'll obstruct airflow. If it doesn't, now there's some people that can be aware of natural drainage in the back of their nose in the morning hours. I would not do anything as far as treating that. There's also a few people getting into this discussion that they'll have extra secretion in their throat that they feel might be coming from the nose if they have real poor dental care. They really neglect their teeth terribly badly. And they can feel, you'd say, well, don't they feel it in their mouth? Well, they might, but they might feel it in their throat. They might feel it in their throat as well. But this patient we were talking about, to be repetitious and evident, he doesn't have a nasal problem. He doesn't. He's convinced that he does, and he might be unhappy when he leaves the office. But explain to him the functions of the nose. And since you're not having trouble breathing and you can smell well and you're not getting a lot of material from your nose, I would not treat a nasal, but I'm going to make an assumption that it might be secondary secretion. Secretion that collects in copious amounts within this area has to come from the lung, the esophagus, or the nose. If it's coming from the nose, it'll manifest itself anteriorly as well. If it doesn't, don't pursue that because you can't justify it. You can't justify it. Well, I think time's up, isn't it?
Thank you.
Thank you.